Hi, this is JP. Welcome to my depression wellness class video training to go with the workbook that I assembled for my depression wellness class. It's in rough form, but you'll learn a lot from this. So what it is a depression wellness coloring workbook. It's split up into 6 different parts so that I can uh, put 6 different videos to train like each section and explain it. It's for anyone who wants to do self-help, wellness, and recovery for their depression. So it can be in addition to meds or as a substitute for meds, but, well, I probably shouldn't say that, but you have to follow your doctors and your therapists. This is not treatment or diagnosis or therapy. This is about wellness and how you can do your own self-help wellness. All right. So in this first video, you're going to learn about the symptoms of depression and how they relate to the body and the mind. And you're going to learn about self-care and explore your downward cycle of depression, so you'll be able to identify your cycle and the triggers. And then you can color to learn and color to process and color your experience or color your future or color your wellness. So there's coloring pages so that you could just, kind of lose yourself in coloring as you're thinking about the information. I'm going to talk about self-nurturing. I'm going to talk about my grapes daily routine, daily wellness routine. You'll learn about negative self-talk and how to reframe that into positive self-talk. You'll learn later about EFT and NLP as healing techniques to help with the negative feelings or thoughts or beliefs. And you'll learn dozens of coping skills and recovery strategies to use when depression is triggered, or when your depression is talking to you, or when your inner critic is beating you up, so that you can reframe that and get back to self-compassion and self-empowerment. All right, so let's just jump into part 1. And so I wanted to started out with a coloring picture of like a pathway, a pathway of recovery moving forward is kind of the concept. And you can add in whatever coloring sheets that you want to use for this. Like I said, I just kind of assembled this, and on the blog post I put where I got these coloring sheets out of which coloring books. So the first thing I added in here was a really good self-care assessment that was created by a trauma group. It's really good. You want to print this out and read it. It's very educational just reading it, and then you can kind of assess and learn about things to add into your self-care and just sort of keep it, because over the months and years you might want to redo it to see where you're at. So the very first thing I wanted to do was talk about depression, what it is, the signs, the symptoms, the causes, the treatment. This is a sheet that comes out of a nurse's book that's just kind of like a one-page info on all kinds of diseases and disorders and everything. So I thought I'd throw that one in on depression. And then straight out of the DSM, here is the criteria for major depressive episode. So there are 9 symptoms of depression. We're going to get into this in another worksheet a little bit more. But if you have 5 or more of these symptoms, you're basically considered being in a depressed mood or episode or state. So this is a good sheet to print out and just look at the 9 symptoms of depression and draw a line from each symptom into which category you think it fits into, whether it's body, mind, or emotions. There's no really right or wrong answers, but it starts to become clear that these symptoms are affecting your body, mind, and emotions when you're depressed. For example, feeling fatigue or loss of energy is usually in your body. Weight loss or weight gain is in the body, whereas depressed mood or feeling sad or tearful or just empty and blah is your emotions. And then not being able to think straight or concentrate, or concentrate on a book you're reading, or feelings of low self-esteem, etc. Those are symptoms of the mind and the thinking. So once you kind of see where the symptoms fit, it gets a little clearer that, well, kind of makes sense to me that if I do body wellness and mind wellness and emotional wellness, I can start to counteract the symptoms of depression in those categories. This is a real good sheet that talks about the cycle of depression. Generally, there's a downward cycle of depression, but there's these mini cycles within the larger cycle. So you have 1, 2, 3, 4, 5, 6 mini cycles in the downward cycle of depression. So you want to print this out and write down a couple examples of how your depression is. Like, what automatic negative thinking do you have that you have when you're depressed, or that makes you more depressed? And how you ruminate on negative thoughts or being hard on yourself, and how that makes you depressed, or how when you're depressed you tend to be harder on yourself. So see that little cycle. And then how when you're depressed your motivation goes down, you have physical aches and pains, and that makes you more depressed, and when you're depressed you have less motivation and more physical pain. So this is like a mini cycle, and each of these mini cycles are adding to the whole big downward spiral of depression. So look at examples of what mood and emotion you have when you're depressed, what negative view of self, the world, or the future you have that's locked into the depression core, what unhelpful behaviors or coping skills you're trying to use, like self-medicating or just trying to isolate, or things that cause your depression, but then you do more when you are depressed. So it just kind of self-fulfills itself with these little cycles. And then the sixth cycle is withdrawal and avoidance, isolating, not getting social support, which just adds to depression. So once you have this, if you put a little example of each section of what it's like for you, you can get a good overall view of what your depression looks like and what's going on. Because in each of these categories, you can do something positive to start to reverse each cycle. So for example, if you start to take your negative thinking and turn it into positive thinking, instead of attacking yourself, start loving yourself and do the self-care stuff. For the motivation and physical symptoms, a daily routine helps, so that you just sort of do a routine whether you're motivated or not, which actually helps you feel better. Start adding some wellness behaviors, some healthy behaviors, and have experiences that pick up your mood and have, good emotions. So doing pleasurable activities, and then do a little bit more social activities, or at least wellness, self-help reading, or connecting with others to kind of counteract the withdrawal and avoidance. So just seeing these symptoms you do and coming up with some ideas and strategies for coping skills for each one of these is going to serve you greatly in reversing the course of the negative cycle and start that upward spiral of recovery. So that's enough thinking for this section. I added in this picture because I just kind of like the idea of creating your life from the ground up and, building your recovery and wellness. And I just like the view of this picture. So you can add another picture if you want, or you can, color this picture while you're thinking about what upward spiral of depression, wellness that you want to start creating. So for example, if you're depressed, think of yourself in the basement of these buildings, and as you do more and more wellness, you're kind of moving up the levels or up the floors so that you're getting away from the negative behaviors that keep depression going and starting to add in. So I always like to increase positive things before I try to work on, you know, getting rid of the negative things. Just start adding in positive things. And we're going to get more into that in the next video in the next section. So thanks for listening, and I'll see you on the next video.